Now, right now, 6:20 a.m. in the morning. I'm exhausted. If I can actually do a car talk today, that's a huge feat. That'll be a huge accomplishment. If I can actually get a car talk done with how sleepy I am. Second day at work in the ER. I'm tired, man. What we represent, man?
Big money bound.
So let her know, man.
Big money bound.
The kids, man. We got the kids, man. Bro, I don't know, man. I don't know. I don't know. I don't know. I don't know, man. Second day back. Gotta cut some lights on the song, man. My second day back. I'm extremely tired. My first day they had me doing the floors, so I had a really pretty easy, smooth selling. Came back the second day in a row. They threw me back in that fire, man. They had me in the ER. And I told y'all, this hospital has like 100+ bed ER, so I was covering the whole ER by myself. I went down there, went to the ER, got a report. And I'm still afraid, so I don't wear my work scrubs while I'm in like the hospital. So I went and changed my scrubs into the blue surgical scrubs, which is why I can come into my car wearing this, because while I was working in the ER, I wasn't wearing my scrubs. Like, I'm still scared, you feel me? Like, I'm not letting my guard down from COVID-19. It's over, it's over. Go and check the statistics, man. It's still like 10,000, 12,000 people per day is becoming infected with COVID-19. I don't want to be one of those 10,000 people. I'm just going to protect myself, man, keep my guard up, you feel me? Like, it went down that first time and it spiked back up. Like, I'm just trying to, like, bro, stay safe. With that being said, I got a call from the triage place in the ER. It's like triage is where like all the patients come through, they get seen before they go to the back. Triage also gets the calls from like the paramedics, the ambulance, the firefighters on the outside saying, hey, we coming in with like a priority 1, a priority 2, priority 3. I get a phone call. Hey, they got a patient's coming in, having some shortness of breath. They got breathing treatments going now. They go in to room 84B. I'm like, all right. Thank you for the heads up. But I can tell from like how you telling me that you want me to continue to give treatments once the patients get here. So I just asked, are we gonna test that patient for COVID when they come in? Because from what I know is, you don't want to give a patient a nebulizer treatment until you know their COVID status. Because if it's COVID positive, they just spraying that's all those aerosolized particles going everywhere in the room, all in the air. Everybody, you feel me? In your head, breathing in on your clothes. I'm like, hey, I'm just trying to play it safe. Nurse on the other end of the phone is like, well, I'm tight, kind of weak. We don't really stuttering up. Not we don't always do that. You can You can ask the doctor if you want to. I'm about to say, like, when did they stop? And why would you not do that? Like, but I gotta remember, I just came back to this job. I'm considered a new hire. I got a 90-day probation period now. So, hey, I can't afford to have, like, a conflict with anybody. No matter how small, no matter if it may not go nowhere, but I can't even take the chance of getting in between that, you feel me, that money, how I'm gonna provide for my little one and my lady. So I said, no problem. No problem. I go in there, check on the patient. Patient is doing good. Patient is doing good, man. They order BiPAP for the patient. Do I think the patient status warranted a BiPAP? No. You on 2 liters nasal cannula, satin 100. But, like, sometimes you just gotta, like, you gotta follow orders, though. You feel me? You just have to follow orders. Like, some of it is just like, it doesn't make any sense. It's just, and when you try to, like, convince the doctor why we should take a different approach of treatment for this patient, it's as if, like, you're trying to, like, show them up. Like, bro, we just trying to, like, I'm here for patient care. I'm here to, like, do no harm, patient care. Like, take care of the patient. So I was like, hey, that's your order that you want? I like reassure. I want some reassurance. I want confirmation. Okay, you sure you put in for this or that? Yeah, this is what I want. I think it's gonna help you. Hey, understandable? I got you. Put the patient on BiPAP. Everything was going good. Hey, I'm sorry for yawning so much, but I don't know what's going on. I just came back from like 2 months off, 2.5 months off. I ain't do no work. I ain't touched nothing. I kicked back. I was laid up. Just feel me. Hey. So now I guess when I'm getting back in the groove of things, like, I'm still kind of tired. Still, like, I got to get back into the swing of things. I had another patient. They wanted on BiPAP. Patient sat, man, 97% on room, man. No, you know what? 2 liters. No, 4 liters. It was on 4 liters, sat 98%. 4 liters is how much FiO2? If you don't know, the easiest way, man. Every liter flow you go up, that's plus 4. So 4 times 4, that's 16. Then you just add 20. That's 36% right there. Sat 98. The order says BiPAP 100% FiO2. Like, come on, man. Like, hey, man, some of this stuff, like, you can't make it up. Why would you, like, 100%? And then it's like, Randy, why would you put them on BiPAP if they satin well? BiPAP is also used to, like, help rid the body of, like, excess. BiPAP is also used to, like, rid the body of excess fluid. Like, too much fluid around the heart, around the lungs. That BiPAP and that pressure can help, like, drain the body of that fluid. Then they also give them water pills so they can urine it out and flush it out. Keep flushing. So a lot of doctors use, like, BiPAP for that. So it's not always about the FiO2. But it's not always about the SpO2, the patient saturation. But when your saturation is high and you're giving a high FiO2, too much of anything is a bad thing. That's the same thing with oxygen. Like, oxygen is a drug, like oxygen toxicity. Like, too much oxygen can hurt somebody. So if you sat at 98% on 36%, why would I put it on 100%? Hey, man. I seen the orders. That's what the order said. But it's a universal order. Every respiratory therapist can adjust the FiO2 without no problem, without an order needed. You can adjust the FiO2 from what I know. Now, you may be somewhere where you can't even touch your own vent. I don't know. Please let me know. But where I'm at, now you can do your FiO2, no problem. Now, when you go to changing rates and tidal volumes and modes, whoa, now you got to consult the doctor. Now I can go in there and just turn the FiO2 without letting nobody know. But you gotta inform at least the nurse. But you don't need the order to just adjust the FiO2 where I'm from. So I put dog on 35%. I'm not finna sit up and hurt them. I'm not doing that. Patient's like, I never used BiPAP before. Hey, my bad. Patient was like, I never used this before. I put it on him. He's like, oh man, this is helping me. It's like, it's pushing the air inside you. Yeah, that's what BiPAP does, dog. It pushes the air inside you to help inflate your lungs and helps you exhale the tidal volume as well. So the patient was like, yeah, I never had this before. I'm glad you're enjoying it, man. It's gonna really help you out. They said, yeah, I can finally get some sleep. Hey, that's real, man. So like, my night wasn't too bad. Like my night was, it wasn't too heavy and it wasn't nothing I couldn't handle. But for some reason, like the people within the nurses within the ER kept calling my supervisor, saying like, come help, come help, come help, come help. So my supervisor hit me. I'm like, hey man, everything good? I'm like, yeah, everything great. What's going on? Or they said they needed me over here. They said they needed me over there. I'm like, no, like, I took care of the situation. Everything was good. But in their mind, if they call me to go to one room and they need something else in another room, they know they just called me. So they gonna call my supervisor who's supposed to be helping me if I need help. But like, I can multitask. Like, I know how to like set a patient up on BiPAP, set a patient up on treatment, assess that situation, keep that situation going, go way across this hall, figure this out, fix that, get that going, go over there and do that there, and then come back to this, because that's how I had to work in this facility. Like, this is a busy place. Everybody know if you can work here, you can work anywhere. You feel me? So I had a lot of that going on. I had 2 priority 2s coming in. Drug related, drug overdose. Y'all already know how they go. They get the feeling woozy and woo, I get so you feel me? So that kind of situation happened. So they en route to the hospital. They call in the hospital saying, yeah, they call in triage. Hey, we coming in. We got 2 patients, drug related, drug overdose. We coming in. So they call me. They thinking patient unresponsive. But like y'all know, man, you take so much of that sticky, icky, ooh, you're going to be unresponsive. They give you Narcan, you're going to wake right back up. So, but you got 2 of those coming in, so you just saying, okay, he going to be at this one. We need somebody else to come take care of this one. They call him a supervisor. Not knowing is one of the drug related cases that came in had already been given Narcan. Patient is up looking around saying, hey man, what happened to the party? So like, they came back, like they're good. Saturation was 99 on room air. The next one came in, the same exact thing. So if it was like something like serious, like unresponsible, gotta be intubated, 2 people, then yes, I would need help. But with this situation here, we gotta like see how it goes. Y'all gotta just like, you can't panic during an emergency. Like, that's one thing I don't do. Like, hey bro, hey, like not slowly, but efficient. Like, you gotta move efficiently. I'm trying to go. You ever been on forgot something, dropped something, missed something? Like, bro, you gotta chillax, you gotta calm down and relax. And I was kind of getting like, I don't like for nobody to like just call, like skip over me and call my supervisor. Like, bro, hey, I'm right here in the ER. Like, if you need me, call me. So I went up to my supervisor, like, yeah, I walked up to the department, like, hey man, like, what's going on? Why they keep calling? I was like, it's a new system where the phone numbers within the hospital have changed, so they just call in old numbers. You feel me? Some people know your number, some people know the old number. So that's how they keep calling me. Okay, so it ain't nothing personal. What they saying, I ain't doing my job, I need help. Oh, cause hey, I was gonna say, man, you feel me? Cause you feel me? I just got back in here, and I don't want no trouble with nobody in here. Man, y'all know I gotta stay wavy. Hold on, let me just check this here. Alright, I'm wavy. But yeah, so that was my night. The ER wasn't bad at all. Yeah. Wasn't bad at all, man. People want to keep asking, where was I at? Like, was it good while I was at? Hey, bro, I was taking care of my mental health, dog. My head was hurting, man. Yeah, my head was hurting, dog. Yeah, my head was hurting. Now, you can assume that he lying, yeah, whatever, he lying. But if you don't know, you don't know. I ain't gonna tell nobody not. If you follow me on YouTube, you Big Money Bound TV, you already know what's up. But if you don't do that, you don't need to know, man. Speaking of that, I appreciate all the supporters. Today my day off. They gave me this new crazy hectic schedule, man, but whatever, bro. They got me working 3 days in a row. That's my schedule. 3 days in a row. The only time I normally work 3 days in a row was if I was doing that third day was overtime. Now it's mandatory I gotta do 3 days in a row. That's ridiculous. But on the flip side, it'll give me 3 days off in a row. And then I work one, then I have another 3 out. Like, so it got its perks now. I ain't gonna lie, it has its perks. It does have its perks. But that's the situation at hand. I may just sit right here, bro, and take a nap because I'm too tired to drive. I ain't gonna even lie to you, man. I am tired. But I told myself after every work shift, I'm creating a car talk after every work shift. Before, I was just doing like every other when I felt like it. If I wasn't tired, I don't care. Tired, sleepy, sleepwalking. Every day after work, I'm giving the respiratory therapy, respiratory car talk video. That's what I'm gonna create. So I'm gonna get back to like having a lot of videos throughout the week, man. Just keep rocking. I got us. I appreciate all the support.